Good afternoon, everyone. It has been great to be speaking. It is great to be speaking to you here on what has been a beautiful day on our island. Last week, we heard from Margaret Knight, the head of our infection prevention and control team. This evening, I am very pleased to be joined by Dr. Duncan Gerry, who is our consultant geriatrician. Before we turn to Dr. Gerry, I shall give you today's statistics. The total number of tests undertaken stands at 4,669. The total number of tests returned stands at 4,648. So the total number of outstanding test results is 21. The total number of cases testing positive remains at 336. That means there have been no new cases since yesterday's update. The total number of active cases is now 6. Before I ask Dr. Gerry to update us on his work, I would like to pick up on something that has been discussed a little on social media. In yesterday's statistics, we said that the number of people waiting for tests was 24. The eagle-eyed among you picked up on the fact that this was much higher than the usual daily figure. I know it caused some puzzlement. Some people were worried that we may have been about to announce new confirmed cases. There is actually a much simpler explanation, and in fact a good news story. As the Chief Minister mentioned last week, and as we heard from Dr. Gregor Peden on Friday, because you have done such a great job of suppressing the spread of the virus, the number of calls to our COVID 111 line are now at a much lower level. Because of this, and because we established our own testing facility on island, we found ourselves with spare capacity. The Department of Health and Social Care looked at how we could put this capacity to best use. We decided to offer weekly tests to those key workers who work with the vulnerable or in direct one-on-one contact. At the moment, this includes those working in care and residential home settings, supported living and voluntary sector partners in those fields. It will also include prison and police officers. I'm delighted to have been able to offer this to our frontline workers. We will review each week to see how demand looks. If we are able to widen the categories that this is available to, then we will. We will, of course, want to ensure that we maintain a certain capacity to deal with needs at the hospital or referrals from COVID 111. This takes me nicely to Dr. Gerry. Our testing strategy, along with the tracing and self-isolation process that follows where there's been a positive case, is one part of our success story. Preventing the spread of infection in society and generally among vulnerable groups in particular has also been crucial in preventing a spike in cases and a surge in demand at the hospital. One important task in this area has been to offer proactive assistance to residential homes so they can become and remain resilient to coronavirus. Beefing up that resilience has been the job of a special task force we set up some weeks ago. Like other initiatives across government during this crisis, we've drawn on the expertise, commitment, local knowledge and insights of our own professionals and subject experts. I'm very pleased to welcome to the briefing today our consultant geriatrician, Dr. Duncan Gerry, who will tell us more about the team and the challenge it's taken on. Dr. Gerry.
Thank you for inviting me today to talk about the actions we've taken to help the care homes on the Isle of Man cope in the face of COVID-19. We realised very early on that COVID-19 posed a significant risk to the integrity of the health and social care services on the Isle of Man. We also realised that it posed a significant risk to the frail and vulnerable elderly residents of our island. We've also seen from evidence around the world that COVID-19 poses a real risk to care homes, and that what we need to do was increase the resilience of these care homes to cope in the face of COVID-19. So that was therefore our aim, to increase the resilience of care homes, and our hope in doing so was to reduce the transmission of COVID-19 in the care home to care home staff and other residents. We felt the best way to care for everyone is to care for the carers. The journey has been a collaborative one. with a multidisciplinary team spanning the acute and community settings. Having only been on the island a few months, it's been my pleasure to meet and work with my GP colleagues, the senior nurses in the hospital, infection control, and many of the caring staff from numerous care homes. Planning to minimise the risk in the care homes has become a three-part process. Firstly, we assess care homes and their current state of preparedness, and we offer guidance and advice on how to improve the now, and then to carry on with the second part, which is an ongoing support and assurance process. Lastly, there is a team who will visit care homes should an outbreak occur to rapidly assess and respond to new cases in care homes. In the first step, the assessment and supporting the preparedness has involved infection control, senior nursing, care home managers, staff, general practice and hospital consultants. We assess the policies and processes to do with infection control and personal protective equipment. We review the education and training of the care home staff. We assess the environment in which the carers work and the residents live. And we pay attention to the particular challenges for and posed by residents should COVID come to call. From this, we've generated a matrix with a red, amber and green rating, and this informs the second part of the process and the ongoing support to make sure we maintain our state of preparedness. This process has been invaluable in terms of learning for both the community and us, with each visit giving an extra layer of detail that the next home benefits from. The outcomes are collated and we discuss them all as a team at the end of every week. Regarding outbreaks, we felt the lowest number was the right one, and we determined an outbreak to be a single new positive test in either a carer or a resident of any care home. And we've responded to care homes now on 2 occasions. The outbreak response team is very similar to the initial assessments, with again community and acute colleagues, nursing, medical and care home staff. We meet the team together at the care home either that afternoon or the next morning, weekdays and weekends, and we review again the current state of PPE stocks, the use, the environment, and in particular on this occasion we assess the care needs of all residents to make sure we can organise immediately the appropriate level of care for each individual. The assessments we've undertaken have all been done with consent of the care homes and are as intended as a support mechanism for them. Not only do we hope that the mechanics of managing infection, the process of doing what we do, is managed, but we hope in some way to provide some emotional support for all our colleagues across health and social care. COVID-19 is scary, but manage it together is less so. Thank you.
Thank you, Dr. Gerry. And thanks also to your team for all that you do. A great demonstration of agile work across disciplines in this challenging time. As I mentioned in the statistics, we again today have no confirmed cases. This is, of course, wonderful news, and it gives us plenty of cause for optimism. And it is not just us. The situation in the United Kingdom is steadily improving. They now appear to be past their peak and starting their exit. It was also encouraging to see that in Northern Ireland and in the Republic of Ireland, there were no reported deaths yesterday. I know people will be absolutely tired of me saying this, but we must not be complacent. Even though we now have so few active cases, we still have to assume, for the moment at least, that the virus is still present in our community. Why do I say this? Well, when we have conducted the contact tracing after the last few confirmed cases, there have been no obvious link to another known case. They have to have come from somewhere. It is not immaculate contagion. We have to remember that a significant proportion of people who contract the virus only show very light symptoms that they may ignore or write off as something else. Others can show no symptoms at all. This is why we need to keep focusing on the basics that have had such an impact: hand washing and all the rest. And for the moment at least, we have to ask you to keep your distance from others. Even as we try every day to give you back more of your lives, we continue to share with you the best guidance we can. Less and less of it will be laws. More and more, it will be guidance for you to make the decisions that best fit your circumstances. A great example of this is how our businesses are responding to the need for social distancing. Yesterday in Tynwald, the Chief Minister laid down the challenge. He said that businesses, and here we mean all businesses, including office-based, were best placed to decide how to ensure they were providing a safe space for customers and their employees. We will lay out the standards and they can work out how to make their businesses fit this. I saw an excellent example yesterday of how we are working together to make this work. The Isle of Man Chamber of Commerce conducted a webinar for the hair and beauty sector on how to safely return to work. They were joined by the head of our business agency and our Director of Public Health. For anyone that missed it, there is a recording of the webcast on the Chamber's website, and I am grateful to the Chamber of Commerce for stepping up. This is the model we want to replicate more and more. We are not going to meddle. We will be there to support and advise, and if necessary, to step in and take action if we feel companies are putting people's health at risk. As we continue to step out of your lives, we need you to step up and take more responsibility. You will hear that more and more from us, maybe as often as you hear baby steps from me. And I will now take questions. And first up today, I've got Paul from MTTV. Paul.
Thank you, Minister. I need to take you back to Tynwald yesterday and the emergency powers discussed by Mr. Boot. I think it was number 8 on the list. You're obviously quite aware that one of the Council of Ministers voted against the proposal for emergency powers to be extended as far as planning. And I need you to confirm, as far as I read everything, that that is against the Council of Ministers rules, and Mr. Thomas will have to be removed. Your comments, please.
Well, I'm not going to speculate on things in relation to that, Paul. Members of Tynwald, obviously there's a government code that applies to all ministers, myself included, that where something is agreed at Council of Ministers, we have a debate there, we have a vote there, and then collective responsibility applies. There are certain exceptions to that, which is where a pre-declared position, the member has a pre-declared position, or it appears in their manifesto. So in relation to that, that is a matter between obviously the Chief Minister and the relevant ministers. It's not something myself as Minister for Health would be involved in.
As far as I'm aware, this is the first time that there's been this sort of conflict, and I understand there has been conflict. So if this is as it stands, if this is what is gone on, will Mr. Thomas have to stand down?
Well, that's not for me to answer, Paul. I'm not the Chief Minister.
I'm
the Minister for Health and Social Care. And in terms of ministerial, the old famous phrase, Paul, first amongst equals. The first amongst equals is the Chief Minister. The rest of us at a ministerial level are all equal. So I am not privy to anything more than any other minister is. How the government code is interpreted and applied in terms of ministers and who is in a ministerial team at any one time is a matter for the Chief Minister. So I'm not privy to anything more than you guys are in that regard. I don't know if Mr. Thomas had a pre-declared position, if that position has been agreed with the Chief Minister beforehand. I wouldn't be privy to those discussions.
Okay, just to finish then, would you expect the Chief Minister to clarify this as soon as he can, what is going on?
I would suspect so. Now that you've raised the question, I would expect that it would be clarified.
Okay, thank you.
Okay, next up I've got Sam, Isle of Man Newspapers.
Good afternoon, Minister. I just wondered, with the extension of tests being available to frontline services, we've heard throughout this that our teachers are, of course, on the front line. Why has it not been extended to them and to their nursery school colleagues?
Well, actually, Sam, at the moment, of course, the schools are only operating around the hub system. As we move towards the schools doing their gradual reopening, that is one of the things I'm very keen to see it extended to. And I've actually had conversations within DHSC this morning. I'm beginning to wonder sometimes with the questions, if you have my office bugged, you always seem to manage to pick up on questions I've discussed that day. But I have actually been discussing that this morning as to how we can use any extended capacity. We started the expansive testing of key workers last Wednesday, and what we needed to see was how much of our demand that filled up, because what we don't want to do is overpromise and underdeliver, particularly in terms of testing. We know the On-Island Test Centre has 200 a day capacity to be able to process, and we needed to see if we got a sudden surge of frontline workers in the other areas wanting to take up this testing, bearing in mind it's not a one-off test, we're offering it on a weekly basis. We need to be certain we weren't offering it out further and then disappointing people by going back and saying, actually, because the demand has risen, we are not going to have the capacity. But there is still capacity in the system, and that is certainly, from my point of view, the next thing I want to have looked at, to be offering it to those teachers and nursery workers who are on the front line with our children.
Thank you. And just secondly, I know we return often to the subject of the border, but as you said, we've had I think it's now a week with no positive confirmation tests, at least. We've had the island of Ireland recording no deaths over 24 hours. The UK, their level is dropping as well. I just wonder, at what point will this return to the agenda for the Council of Ministers to look at whether we do perhaps open towards Ireland or open towards Great Britain?
Well, all policies, and that includes borders, are reviewed on a fortnightly basis. I do have to say, before people get excitable, I think borders is a long way off. As the Chief Minister keeps mentioning at these press conferences, it's going to be one of the last things that will be unwound, because it has given us a great degree of protection. It most certainly has contributed to suppressing the virus on Ireland. And what we don't want to do is get into a false sense of security and then end up with any form of second wave coming in, because that would undo all the hard work that the Manx public have done to date. And I certainly, as Minister for Health, don't want to see that. So I know there's frustrations from people who want to be able to go and see their loved ones in other countries. I fully recognise that. But one of the greatest tools we have in our arsenal is that border control. And it's important that we keep using that tool while it's necessary. There are positive signs coming out of the UK. Clearly, from the current data, it appears they're past their peak and they're coming down the other end. And obviously, it's great news with the Republic of Ireland and Northern Ireland not recording any deaths yesterday. But again, as I've always said with our cases here, let's not just focus on one point in time. Let's see what the longer term trend data says. And if we start seeing longer term trend data like that from our neighbours, then obviously the situation is more encouraging. But I go back to the point I've always said, which is border controls doesn't just rest on what happens here on Ireland, it also rests on what's happening in our near counterparts and perhaps even slightly further afield.
Thank you.
Next up, I've got Alex at the BBC.
Hello, Minister. Just to return to the case, the cluster at Abbotswood, if you please, could you give us any update regarding the current numbers of positive cases among former residents there, and indeed how many former residents have now been rehomed?
So in terms of numbers of active cases amongst Abbotswood's residents, I believe there's currently 2. There is only 2 remaining who are active now. And in terms of residents being rehomed, that process has started. And I believe roughly between 6 and 10 have now already been rehomed. And there is more being rehomed over the remainder of this week. In fact, I was contacted by a family of someone who's been rehomed earlier this week to thank the department for the work that they've done and in getting them rehomed, and that the couple have settled very well, which was very heartening to hear, because it has been a disruptive process. As I said, the ideal solution would have been for residents to stay where they were. That couldn't happen. So we do recognise it is a traumatic time for people having to relocate, particularly in that age group.
Yes, I think we might have spoken to the same family there, actually. It was positive to hear that. Just to clarify on that, you mentioned there are 2 active cases. Are those 2 in hospital currently?
So the 2 active cases are not in hospital as far as I'm aware. I think they're within the Newlands area but they are currently still active. But I believe in a couple of days they should be free of the virus.
Thank you. Could I ask a question of Dr. Gerry, please?
Of course.
Hello.
Hello, Dr. Gerry. There was some quite concerning news, which I'm sure you've seen from the Royal College of Psychiatrists in the UK today, that suicide attempts by elderly people may have increased sharply during the coronavirus crisis. What support options are on hand from the DHSC, especially psychiatric and psychological help for elderly people who haven't been directly affected by COVID-19, but as a result of the lockdown, whose mental health has suffered?
I'm going to be entirely honest with you, I'm not sure I've got the knowledge of that service to be able to speak directly to it. The Minister believes he can answer some of those questions for you.
Fine, thank you.
Thank you, Alex. That's probably a bit far out of Dr. Gerry's remit. It's more I'm probably better placed to answer that. One of the things, it's a very concerning figure that's been seen in the UK. Most definitely, I've seen those reports. But one of the things we've got to remember is that the UK was in lockdown for a substantially longer period of time than we were. We've moved into a stay safe phase. But one of the things we've also been doing is continuing with our online mental health checks. For those that are in the vulnerable category, they have been regular contact from the department with guidance. There has been welfare checks for those who we know are the real most vulnerable in the society that we've identified. Things that, to be perfectly honest, on the size and scale of the UK, they haven't been able to undertake. So people have been left without any form of support mechanism. So we have been doing those regular welfare checks, and thankfully we haven't seen that spike in the way that the UK has in those very tragic circumstances. But I think also, like I said at the very start, you've got to appreciate the UK was in lockdown for a substantially longer period than us, where people really were isolated in their communities, all their support networks gone. That is why we were very clear from the very start of this that we wanted lockdown to be as short a period as possible to move into our stay safe phase where we are now, so that people could still get that help and support.
Thank you very much.
Okay, next up I've got Rob from 3FM.
Good afternoon, Minister.
Good afternoon, Rob.
My first question, again, sorry to come back to the point of borders. I know it's been mentioned plenty of times, it could be for the foreseeable future that they're closed and that there are no specific dates regarding it. I just wonder if you could give us an idea, though, of when that date, what is the threshold in terms of the likes of cases or whichever, in which you could start to consider it, not necessarily do it on a particular day, but start to consider that point of figures, as it were?
To be perfectly honest and blunt with you, Rob, it'd be like trying to guess the number on a roulette wheel, because there is so many different variables. So you may have a situation where the island, as now, is very, very low in cases, or with no cases at all. You could see the UK see a second wave of the virus, in which case the situation would change. If the UK continues on its downward trajectory, and the same is happening in the Republic of Ireland on the other side as well, there's various options that can be looked at. One of the questions that was raised with the Chief Minister last week at the press conference was around air bridges. I think at one of the briefings I explained they come with their own problems, because you've got people who would be able to use an air bridge to go both ways. It's not just a one-way street out. It allows people in. So there's too many factors to be able to put any firm date on. But the sort of things you would be looking at is low instances of transmission in the UK, low instances of transmission in Northern Ireland and Republic of Ireland, and obviously a real low level of transmission and risk here in the Ireland community. So if all three of those slot together nicely at the same time, then that's something we can look at. But we do have to be aware that when, it's got to be done in a risk profiled way. So again, the changes with borders are likely to be in a staged process. So we're not going to go from borders locked down to borders open the next day. It is more likely that there will be a staged process of certain things being turned on in a gradual way.
Okay, thank you. My second question is either to yourself or Dr. Gerry, whoever may be in a position to answer. Obviously, the priority has been to protect our older residents from COVID-19, but there are many elderly residents out there who will have other things they are dependent on in terms of medication or therapies, what has been available and what will continue to be available at the moment for them outside of protecting them from COVID-19?
I think that's probably more for me than Dr. Gary. Yes, and Dr. Gary agrees with me. In relation to medication, we have tried wherever possible to continue to supply medication to those vulnerable in the community. St John's Ambulance has done an absolutely excellent service engaging with the community dispensaries to being able to get that medication to people. So those who can't go out and collect it themselves from the pharmacies, there has been a full delivery service in place. Again, something we've been lucky to be able to put in place being a small island. In terms of therapies and so on, as you know, quite a few services that DHSC deliver have had to be turned off in order for us to do our COVID-19 response. But as I announced on Friday, we now have a Back to Health programme where we are on 2 weekly basis starting to turn those services back on. So more and more therapies are becoming available. I've already made announcements around chiropractors and those sort of auxiliary services. So we are driving forward on that, but it was necessary when we needed the full frontline response. And it's easy to forget now that at one point our caseload was actually quite high from COVID-19. We were actually seeing increasing numbers of cases, and at that point we needed to have more staff on the front line there, and it did mean suspending services. But we are now at the point where services are starting to slowly turn back on.
Okay, thank you.
And then last up, she's waited patiently, I've got Amanda from Jeff the Mongoose.
Minister. My first question is either for you or Dr. Gary. I'm not sure who's best placed to answer it, but I wanted to build on Alex's question. Are there any other specific illnesses or problems you believe are emerging in elderly people on the island as a result of COVID-19 measures such as shielding? And are you seeing a general negative impact on older people's well-being and health since restrictions have been put in place?
Well, if I can answer first, and then I'll bring Dr. Gary in case he wants to expand on it. In relation to the negative experience, obviously there are some people who have been shielding, who are shielding on their own. Psychologically, that means they have been divided off from family. I know we've been keeping a very close eye on quite a lot of people who we believe to be in the really vulnerable category with welfare checks and calls to make sure that they're okay. Speaking to the mental health services, we haven't seen that deterioration, thankfully, of things coming through. A lot of people who are shielding, I've spoken to quite a few, particularly in the older age group, that have come back and said to me that even if the government advice wasn't to shield, they probably would anyway, because at the moment they don't feel comfortable in going out and having that wider community engagement. And that's perfectly all right. The whole thing with this process is we are going to be asking people to take decisions themselves. We'll issue advice and guidance, but people have to do what's right for them. With the advice around people shielding is in the process of being updated. And I can confirm, and I'm happy to confirm right here and now, we will be writing out again next week to all of those shielding with updated advice. But obviously, one of the other things that's impacted the elderly population is the turning off of some of our services, elective surgery, for instance. So I know of people who have been waiting for hip operations. Obviously, that's been pushed back. That's something that can cause pain for them and make things difficult, and we fully appreciate that, and that is why we are so keen to start in a managed medical way getting our services back up and running so we can return as many services to as close as normal as we possibly can in as short a period of time as possible while still doing it in a medically safe way. And I'll bring Dr. Gary in case he wants to say anything.
Hello there.
Hi.
Agreeing, I'm not talking about the services that have been turned on or turned off. I was going to say one thing which was quite heartfelt to me is that I think one of the greatest problems with COVID has been fear. And actually, sometimes fear stops people doing what they would normally do under normal circumstances. And so the fear of the hospital for some people has been very great, and some elderly people haven't come to the hospital for fear of catching COVID in hospital. And that's worried me deeply, because actually my day job, most of the time for the last quite a few weeks and months, has been looking after the business as usual ward, the cold side of the hospital where it's non-COVID. So this is more of a plea really for people, if they do have issues that need to be sorted out, please don't delay coming to the hospital. We've still been doing the on-calls, we've still been the rotors, I've still been looking after everyone that comes in, seeing people on a regular basis. And I really don't want people to miss out on business as usual that we are delivering all the time. So it's more of a plea to everyone to actually please still do seek help when you need it and don't miss out on good quality care.
And can I echo that plea as well? It's something I raised a few weeks ago here at this press conference. Those services that have resumed, they are resumed in a medically safe way. And I really, really would urge people that if they are ill, if they do need treatment, they should still seek support and help as they would do in normal circumstances. It is crucial that people don't just sit on things and actually think that they, leave things to deteriorate. So I would echo that plea. Please, if you do need help and support, contact the services available.
And secondly, we know that contact tracing is hugely important in tackling COVID-19, but are you concerned that if people have broken the guidance, they will not tell tracers the truth? And will there be any repercussions if someone is found to be lying about their contacts?
In terms of contact tracing, we are very clear with people. If they have broken the rules, we are not interested in finding that out to report them to some other authority. What we are interested with contact tracing is finding out who the person has been in touch with and killing the chain of this virus. That is our primary concern with contact tracing. We make absolutely clear to people that, if they are honest with us and they have broken certain rules, we are not going to go running off and immediately report them for that. We actually want to just hear the truth so that we can kill the chain of the virus. Anything people tell the contact tracing team is done in complete and utter confidence. That is all we are concerned with. We are not concerned about what that person was doing on their Friday night, the Saturday night, whether they were bending the rules. We are just interested in finding out who they've been in touch with and in contact with so that we can make sure there isn't any further community spread. As I said, there has been a couple of cases of what appear to be immaculate contagion, where it's come absolutely out of nowhere. But I would urge people that if they do test positive, then they really, really should be honest with the contact tracing team.
Thank you very much.
Well, thank you very much to our media partners for taking part again today. Turning now to some shout-outs. Firstly, Fran Cayley from Cronkerberry Hub School has been nominated by a number of colleagues for her tireless work to support teachers, parents and pupils in accessing online learning. Fran has gone above and beyond in ensuring a smooth transition to support students with learning from home and has offered support to colleagues across the island. Second, we've had a request from a number of teachers for a thank you to the cleaning and caretaking staff across the island's hub schools. The nomination says we couldn't teach if these dedicated colleagues didn't provide safe, clean spaces for us and the children. Third, Alison and Steve Taylor run the drop-in charity shops and Renew Wellbeing groups in Ramsey and Derby. They've been busy baking goodies and making cards which they drop off, socially distanced of course, at people's homes. The person making the nomination says, I've had homemade shortbread scones with jam and cream and brownies delivered. All were made at Alison and Steve's own expense, which they deliver around the north of the island. It's the little things like this that really make a difference, and it is very much appreciated. They don't make a big fuss. They just decided to do something for our community. All being well, the Chief Minister will be back with you tomorrow to brief you on COVID-related discussions at the Council of Ministers. Until then, please keep doing what you have been doing so well. It is making a huge difference. Make the right decisions for you, your family, your island, and stay safe. Thank you.